As a urology consultant in the UK, I understand that male infertility can be a challenging and sensitive issue. Today, I will explain the surgical options available to you. We will cover various procedures, their benefits, and potential risks. Firstly, there's varicocelectomy. This procedure involves the removal of enlarged veins in the scrotum, which can improve sperm quality and increase fertility. It is typically performed under general anesthesia and has a high success rate. Another option is vasovasostomy, a surgery to reverse a vasectomy. This procedure reconnects the vas deferens, allowing sperm to flow into the semen again, potentially restoring fertility. Lastly, there's testicular sperm extraction, or TC. This is used when there's no sperm in the ejaculate. Sperm is directly extracted from the testicular tissue through a minor surgical procedure. Each of these procedures has its own benefits and risks, and it's important to discuss these with your healthcare provider to determine the best option for you. If you have any questions, please feel free to reach out. Thank you for watching.